Hello, and welcome to another Rush Generations Health Education Lecture. Rush Generations is delighted to be your source of information, resources, and health promotion programs to help maximize your well-being and good health as you age. Today is Wednesday, October 18th, 2023, and my name is Kim Morley, and I'm a Rush Generations Program Coordinator, and I'm so glad to be back and sharing this space with you as we learn about health and aging topics. I'll be your moderator for today's lecture titled Sleep and Aging. This topic is of particular importance as poor sleep is tied to numerous health concerns and can impact our quality of life as we age. For today's lecture, we're delighted to have two esteemed Rush colleagues join us to speak about this important topic. Before I introduce them, I'd like to first thank Hannah Weitzman for helping with the production of this lecture today and all of the behind the scenes work she does to make these lectures run smoothly. As normal, Hannah will be helping us manage the chat and other key aspects so that we can have a great discussion. As you know, we're live streaming this lecture via our YouTube channel, where we have dozens of other health education lectures that you can always refer back to or send to friends, family, colleagues that could also benefit from the valuable information that our speakers offer every month. We use the video platform Zoom, which also allows us to host a good number of people who will join us over the phone today. For those of you on YouTube, we ask that you please use the chat function to ask questions and or to add to the discussion throughout the lecture. We will make sure that your comments and questions make it to today's presenters. And for those of you listening to the presentation via phone, you will also have an opportunity at the end to unmute your audio so that you can ask questions to our presenters. We greatly appreciate you joining us today. And please note that we always remind you the information offered here is for general informational purposes only, and that for situations specific to you, we encourage you to always seek additional professional advice so that your specific needs are met. Now, I'm delighted to introduce you to today's speakers. First, we have Dr. Tresa Zacharias. She is an assistant professor in the Department of Neurology at Rush. She attended medical school and neurology residency at the University of Texas Southwestern in Dallas, Texas. She then moved to Chicago and continued a fellowship in sleep medicine at Northwestern University. She joined our team at Rush in November of 2020 and sees patients with neurological and sleep disorders. And following Dr. Zacharias is Dr. Naomi Pella. She is an associate professor, double board certified in obesity medicine and family medicine. She graduated from Loyola Stritch School of Medicine and completed her residency at Advocate Lutheran General Hospital, where she was a chief resident. She has additional certifications and awards from various medical organizations. At Rush, she is the Chief of Lifestyle Medicine and Medical Director for Rush Center for Weight Loss and Lifestyle Medicine, where she provides leadership, strategy, and programming for a lifestyle management program. She also serves as the Medical Director for Concierge Services and Medical Weight Loss Business Ventures for Rush University Medical Center, and is the Director of Strategic Development and Implementation for the Department of Surgery at Rush. Dr. Pella combines medical and consulting experience to help people solve problems and achieve goals. As a sought-after consultant and speaker, she works with leaders at companies like United Airlines and to help people feel better, do better, and thrive. Dr. Zacharias and Dr. Pella, we are so excited to have you talking with us today, and I will hand it over to you, Dr. Zacharias.
All right. Thank you for that introduction. I'm just going to share my slides. All right, so today for my talk, we're going to talk about what normal sleep is, how sleep changes in normal aging, some of the risk factors that lead to sleep disturbances in older adults, and some general sleep tips to get you some better sleep. So first off, we're going to start by talking about what normal sleep is. So the definition of sleep is a reversible behavioral state of perceptual disengagement from and unresponsiveness to the environment. So that's a lot of words, but basically what it says is that sleep is a natural process. It's cyclic. It involves some sort of lack of awareness and involves no interaction or minimal interaction with one's surroundings. So this process is basically physiologic, it's necessary, it's temporary, and it's reversible. And what exactly is the purpose of this cyclic natural process? So sleep serves many purposes. It is the time when the short-term memory and information that accumulates during the day gets pruned and processed for longer-term storage. That pruning process of all the information that we've gathered over the entire day also leads to kind of energy replenishment. It's also the time when the brain kind of dumps out waste products, and it's also the time for kind of tissue repair as well. So what happens when we have poor sleep? So there's several consequences to the lack of sleep. Some of these are more behavioral, such as memory impairment, poor judgment, poor decision-making, daytime sleepiness, impaired driving, impaired concentration. But it can also affect our metabolism and lead to increased inflammation, impaired glucose. So those glucose levels can be higher, leading to diabetes. It can lead to weight gain, and it can also increase your risk of cardiovascular events such as heart attack and stroke. So we're going to talk about what are the expected changes that we see in sleep in normal aging. So to sustain life, the minimum number of hours needed to kind of sustain life is about 3 to 5 hours. This is not enough because only 3 to 5 hours will lead to sleepiness, impaired performance, reduced executive function, but it is enough to kind of sustain life. However, we do need a lot more sleep than that, and that requirement kind of varies over the lifespan. So this is a graphic from the National Sleep Foundation, and it kind of gives the average here in kind of like the dark orange, the average number of sleep at each stage of life. So as newborns sleep a lot, they sleep in chunks, but they sleep about anywhere from like on average about 14 to 17 hours per day. As we kind of age, that sleep becomes more and more consolidated. There's less napping, and the sleep kind of occurs in one big chunk. So by the time that we're young adults or older adults, that sleep kind of gets confined to a single period of about 7 to 9 hours. And then as older adults, that sleep does decrease, and we'll talk about some of the specific changes that occur in older adults. So some of the basics, and we'll kind of go over these in some detail. Some of the expected changes that do occur with sleep as we age is the time, the total sleep time does decrease. The number of awakenings in the middle of the night after falling asleep increases. Those awakenings that do occur in the middle of the night become longer, and there's decreased deep sleep. So we'll go into detail about each one of these. So to kind of just describe what happens to total sleep time as we age, this was a study from 2007. They looked at healthy adults aged from less than age 30 to older adults greater than age 60 with no medical conditions. And they looked at the total sleep time over 24 hours. And here in this box in red, we can see that the total sleep time changes as we get older. So young adults on average get about 11 hours of sleep per night. Middle-aged adults get about 9 hours per 24-hour period, and then older adults only get about 8. Another study done about 7 years later showed that the decrease in total sleep time does change per decade, and on average, about 8 minutes per decade for men and about 10 minutes per decade for women as people age. This tends to plateau around age 60, so that continued decrease tends to kind of stay the same after age 60. So bottom line is the total sleep time decreases as people get older. As far as the time to fall asleep, that gradually gets worse as people get older. So in youth, it increases a slight bit. In middle age, it tends to stay stable, the time it takes to fall asleep. And after about age 60, it kind of steadily increases over time. As far as time spent awake after falling asleep, this was from a mathematical modeling where they looked at several studies in combination. And the general trend was that the time spent awake after falling asleep increases over time. As far as the sleep stages, the biggest decrease that is noted with aging is with slow wave sleep. This is your deep sleep, and this is the stage that is kind of responsible for kind of bringing those short-term memories into longer-term storage. It's kind of where the restorative sleep comes from. This naturally kind of decreases as people get older. The other stages, like stage 1 and stage 2 sleep, these are lighter stages of sleep. These tend to kind of increase in proportion to the decrease in the slow wave sleep. REM sleep, which is the dream sleep, that decreases a little bit, but generally kind of stays about the same. And as we kind of talked about before, this is the WASO right here. This is the time spent awake after falling asleep. That does kind of increase as people get older. The sleep latency is the time to fall asleep, and that increases as people get older. But the biggest notable change in the sleep stages is with this slow wave sleep, this SWS right here. That takes a big hit as people get older. And finally, talking about circadian rhythms. So circadian rhythms, they're the internal clock in your body. They kind of set the general schedule of telling your body when it is time to get up and when it's time to kind of sleep. It's in every cell of your body. There's like a liver clock, there's a stomach clock that it kind of regulates all the functions of your body. As people get older, these circadian rhythms tend to kind of degenerate. And this is likely due to kind of decline in function of the master clock in the hypothalamus in the brain, the suprachiasmatic nucleus. And what happens to older adults is there's kind of an advance in that circadian timing, meaning kind of everything kind of shifts earlier. So older adults often go to bed earlier. They often wake up earlier than they want to. This can kind of impede social activities, lead to kind of skipping out on social activities, declining because of sleepiness early in the evening, and then maybe even some loneliness as well, as you're often kind of going to bed before everybody else is ready to do so. The circadian rhythm also kind of decreases in the strength of it, the amplitude. So it's essentially kind of a lower signal. It's not as strong, it's not as robust. And that leads to kind of difficulty falling asleep and also kind of leads to difficulty in staying asleep. As a result of this decrease in the signal of the circadian rhythm, it makes it harder to kind of travel, makes harder to kind of adjust to night shifts. So older adults often have a hard time with kind of traveling across multiple time zones. So now we'll kind of talk about some of the risk factors that lead to sleep disturbances in older adults. So some of these problems that we're going to talk about, one of them being OSA, they could kind of potentially accelerate the sleep problems that we see in aging. OSA, or obstructive sleep apnea, that's a condition where we have short pauses in breathing while sleeping. So either the airway kind of completely collapses or partially collapses. You may not be aware of all those symptoms. You may not even be aware of the breathing pauses, but it can lead to sleep disturbance. It can lead to poor quality sleep, memory problems, mood changes, and fatigue. Some of the symptoms that are suggestive of sleep apnea would be like loud snoring, gasping arousals, frequent nighttime awakenings, morning headaches, dry mouth, and daytime sleepiness. Some risk factors for sleep apnea include obesity, being a male. Postmenopausal women are also at risk. Aging, unfortunately, puts you at risk for sleep apnea. Alcohol can make sleep apnea worse. Having an underactive thyroid or hypothyroidism can put you at risk for sleep apnea. Smoking and a positive family history can also put you at risk for sleep apnea. There's some special populations at risk where we encourage screening for sleep apnea, and this includes hard to treat high blood pressure, heart failure, strokes, mini strokes like TIAs, atrial fibrillation, type 2 diabetes, and any sort of nocturnal heart arrhythmias. Restless legs is also something that's very common in the older population. It can lead to sleep disturbance. And basically what it is like this uncomfortable sensation, unpleasant feeling. People describe it in many different ways. Some people describe it as like creepy crawly sensations in the legs. But there's always like this urge to move. And that movement helps get rid of the symptoms. The rest, or being kind of like once you kind of lie down and try to relax, that tends to make it worse. And the symptoms classically kind of come up in the evening. And it's very common, and it can be easily treated. It should be evaluated with the iron levels. So if there is an iron deficiency, taking iron could potentially kind of reverse the symptoms. There's also lots of medications that can cause restless legs, like antidepressants, dopamine antagonists, antihistamines like Benadryl. Those things can cause this unpleasant feelings in the evening prior to bed. Dream enactment. So what I've found, like from just kind of talking to patients, is that most people don't think much of dream enactment. They think it's just kind of like something silly, something funny, but it actually can be pretty serious. So what is often involved is kind of like kicking, fighting, screaming during sleep. It could potentially lead to injuries to yourself or your bed partner. It's often associated with a vivid dream. In some cases, it can be secondary to medication, sleep apnea as well. But the concerning factor is that it can be an early sign of Parkinson's disease. So if this is happening, I do encourage talking to your doctor and getting things checked out. And lastly, talking about like dementia, Alzheimer's disease, and sleep problems. So it can be disruptive. Sleep can be disruptive for both the person who has the Alzheimer's disease and the caregiver. Sleep can be all over the place in Alzheimer's disease. It can vary from excessive sleepiness. It can involve insomnia, trouble sleeping, sleeping throughout the day in a regular schedule. It can also involve wandering, yelling at night as well. All right, so now we'll kind of talk about some sleep tips. So general safety tips would be to kind of keep the floor clear of objects, just in case you do have to get up in the middle of the night, so you don't trip and fall and cause like injury to yourself. It's always good to have like a telephone near the bed, a lamp that's easy to reach and turn on, have a list of emergency contacts close to the phone, just in case something does happen in the middle of the night. You don't want to be kind of getting up, fumbling around for stuff. Removing rugs can be important to kind of avoid falls. Often kind of rugs are loose. They kind of create some imbalance just because the floor and the rug may be a little bit uneven. So those are kind of some general tips. For those with dementia and dream enactment, would keep weapons, any sort of dangerous objects locked and out of the bedroom. Any medications should also be locked up as well. If you're on like the second level, having some sort of safety gate to kind of block the stairs and prevent you from going down. And then having some grab bars in the bathrooms just for balance and to prevent falls. As far as kind of sleep specific tips, keeping a regular schedule is probably the most important thing. And most important in kind of keeping that sleep schedule is actually keeping the wake time consistent day to day. Part of keeping a regular schedule is to have kind of a regular daytime routine. Morning light exposure can really help to kind of reset your internal clock, keep you awake during the day, minimize the napping. If you do have to nap, I would keep it earlier in the day. I would keep it to about 20 to 30 minutes. Having a nap too late in the day could kind of prevent you from sleeping at night. Prior to bed, I would kind of unplug from electronics, kind of avoid that blue light exposure because that's going to just kind of keep you up at night. In the hours kind of leading up to bed, you want to kind of keep things calm, quiet, dim, so that your body kind of naturally kind of gets ready for sleep. Other things, physical activity can be helpful. I just wouldn't do it too late in the day, as that can be kind of activating, can kind of keep you up at night. Alcohol can actually lead to more sleep disturbances. If you have sleep apnea, it's going to worsen sleep apnea. It can even potentially kind of exacerbate like leg movements at night, restless legs. So cutting back on the alcohol, keeping it like before 2 to 3 hours prior to your bedtime can be helpful as well. Avoiding caffeine too late in the day. I probably wouldn't have like any sort of caffeine after like 2 p.m. Late night eating, try to keep your meals within 2 to 3 hours of bedtime. Anything after that, your digestive system is just going to be active, and it's going to kind of keep you up at night. And make sure your bedroom is really just for sleep. I wouldn't use your bedroom for like watching TV, doing other things. Really just kind of keep the bedroom for sleep. You don't want to associate the bedroom with daytime activities, with watching TV. Just having that separation can be very helpful for people who have trouble sleeping. And then it's important to kind of keep the bedroom as comfortable as possible. Having it a little bit cooler at night can kind of keep you from waking up due to being overheated. Also kind of helps you sleep when things are a little bit cooler. Keeping the bedroom as quiet, using white noise as needed, keeping it as dark as possible can also help with sleep. All right, well, thanks for having me.
Thank you so much, Dr. Zacharias. That was a really informative overview on sleep and aging. It really helped us to, understand normal aging and sleep changes, and also, what we should consider if we're having sleep problems. I love that reminder of good sleep hygiene techniques, because so often, there's all these things we can be doing throughout the day that might disrupt, our ability to sleep at night. So thank you so much for that information. And next, we'll have Dr. Naomi Pella talk about sleep apnea and sleep more in more detail. So I'll hand it over to you.
Great, thank you. I hope you can see the screen. Can you see the screen?
Yes, that looks great.
Okay, great. Okay, perfect. All right, thank you so much. Wow, I learned so much from that presentation, and I get to work with Dr. Zacharias, and you can see why it's such a fun experience and so great for the patient. So what I'm going to do now is I'm going to shift gears a little bit, and I'm going to talk about weight and sleep and how they are related. So I have no disclosures, and I want to be able to answer these 3 questions for you. Why is weight important? Why would we care about this with relation to sleep? How are weight and sleep connected? And what can I do? So I'm going to give you tips, and they're going to be around lifestyle, medications, or surgical options. And there's multiple options. So just to give you a heads up, let's start with understanding weight. Why is weight important? Well, there's all these numbers that people throw around. And in medicine, we use BMI. And we use that as a medical diagnosis, and we use it as a screening tool to assess risk in an individual. So BMI is not perfect. In fact, for athletes, people around menopause or after, ethnicity and age can kind of skew the numbers, right? So somebody might be told they're overweight or obese based on BMI, but it might not necessarily be unhealthy. So I just want to clarify that. There is a term metabolically healthy obese, which means a BMI could be higher and you could still be very healthy. There's also people who are described as TOFI, that's thin on the outside and fat on the inside, meaning around the organs in the abdomen, there can be some extra fat, which leads to things like type 2 diabetes and hypertension. So just to make sure we're all aware, and the really important thing to know is individuals over the age of 65, if their BMI is less than 23 or higher than 33, there is increased mortality, death. And so this is really important because a BMI of 33 is considered class 1 obesity. So again, talk to your doctor about what does your BMI mean for you. We use BMI because it's easy to measure. It's a weight and height. And so pretty much you can get a consistent measurement regardless of who's doing it. And it does correlate with mortality. So the higher the BMI, the risks of death increase at the same age, and same thing if you drop too low. So you don't want to get too low with your weight. But this is why we use BMI in medicine. Also, the top 5 causes of death in the United States: heart disease, cancer, COVID-19, unfortunately, accidents, and stroke. 4 of those, you can see I put a star over them, are negatively affected by overweight and obesity. So this is another reason why I really care about helping people achieve their healthy weight. So how are weight and sleep connected? Well, we know that poor sleep, we just learned this, right, from Dr. Zacharias, poor sleep raises blood sugars, which leads to insulin resistance, which I'm going to explain, and weight gain. So this is really important because we often don't think about blood sugars and sleep being linked. So I'm going to put you through mini medical school. So we're going to talk about insulin. Remember, the body's goal is to have normal blood sugar. And blood sugar is fuel. It's like gas in a car, right? You have to have some. So let's talk about what happens and why this is relevant to all of us. If blood sugars are high, for example, with type 2 diabetes, or even right after we eat something really, really sweet or drink a bunch of something sugary, our blood sugars actually go up. This makes the pancreas, which sits behind the stomach, pump out insulin. And some of you might have heard of insulin, especially anybody with type 2 diabetes. Insulin's job is to bring down the blood sugars. And so if you have high insulin, because you had high blood sugar, it actually has an effect of turning off your body's ability to burn fat at that time. And instead, it puts all the extra sugar, it stores it. And so the fat cells grow. Okay, so high blood sugar, high insulin, fat cells grow. And in that process, your fat cells are actually absorbing that extra sugar, and it's causing your blood sugars to go back to a normal level. Yahoo, right? That's exactly what the body wants. Now, unfortunately, this is a state where it makes it very easy to gain weight. You can imagine if you're not burning fat and you're building fat cells, this is a problem if you don't balance the equation. When you are not eating, so some people are doing fasting, right? You might have heard of intermittent fasting. If blood sugars get low, the pancreas gets a different signal. It actually makes the insulin get a little bit, it sort of drops, and then glucagon gets secreted from the pancreas. And this pattern allows fat burning to happen. So your body can access the fat cells on the body for fuel. So this allows healthy fat loss, right? So you can see if you spend too much time on the right-hand side of this picture, you would be gaining weight very easily. And if you spend some time on the left side, you can balance it out so you don't have to be just in a weight gain state, right? So we talk about this a lot in my clinic. If you continue to push your blood sugars high, and you do this at a very frequent interval, what happens is the fat cells start getting overloaded. They really can't absorb much more. They're trying to grow, they're trying to replicate, but they might not be able to keep up. This leads to an overflow, and we call that insulin resistant because the body keeps pumping out more insulin. It's trying to shove more into the cells, but the cells stop responding, so they can't absorb all of this. This leads to inflammation. So another way to think about this is if people think about somebody with obesity, There's a lot of metabolic and health problems that we know are linked with obesity, like prediabetes and diabetes, metabolic syndrome, polycystic ovarian syndrome or PCOS, infertility, mood and mental health disorders. Through COVID, we learned about all the inflammation and problems that can occur with the immune system, where people have worse COVID outcomes. There might be osteoarthritis leading to pain. Surgical outcomes can be impaired. Cancers, dementia, fatty liver, heart disease, blood pressure can be elevated. These are all associated with obesity. And obviously, as Dr. Zacharias just told us, obstructive sleep apnea, insomnia, and disordered sleep are also associated. The interesting thing is, all of these are insulin resistance. So obesity is a marker of insulin resistance. It means something's off balance, and we can actually do something about it. So that's what's really cool. So let's go there. So going back to sleep and weight, okay? Weight and sleep are linked. If you think about mental stress or changes in your circadian rhythm, it might be because you traveled to a different time zone. Maybe you have shift work where you work at night, or you're up at night taking care of somebody, but you're basically having a disrupted sleep pattern. Or if your sleep is just poor quality, maybe there's sleep apnea that you're not even aware of, or for some other reason. Those change the hormones in the body. We just talked about insulin. Neurotransmitters are the brain chemicals, right? So the happiness chemicals, the anxiety chemicals, all of those get affected. Cravings can increase. Appetite can go up. Physical activity motivation, just even wanting to move, drops, right? That leads to weight gain. And again, like we talked about, obesity, insulin resistance, and sleep apnea are common outcomes of this sort of pattern. So I want to focus a little bit on sleep apnea, because that's something that there's two really good treatments for sleep apnea. One of them is a CPAP or BiPAP machine, and the other is weight loss. So of course, Dr. Zacharias can manage all the CPAPs and all the other methods. I'm going to talk about weight loss right now. So what can you do? So many people ask me, how do I know if I have insulin resistance? In other words, how do I know if I have all those risks or might have those other complications? These are things you might notice. Your waistline has increased. There might be darkening neck and skin folds, like in the armpits, under breast tissue, maybe along the waistline or in the inner thighs. You might notice a lot of skin tags. Infertility is another common concern. In men, low testosterone. In women, they can experience hair loss like men, where it's in the front, or they can grow hair where they don't want to grow hair, like on the chin, right? Or on the belly. And then there's polycystic ovarian syndrome or irregular periods. These are all indications that somebody has insulin resistance, and you don't even need to go to a doctor's office to check this out. In the doctor's office, you can also know if you have insulin resistance if you've been diagnosed with metabolic syndrome. That would be, you might have 3 of 5 criteria: an elevated blood pressure, or you're being treated with medications for blood pressure. If your waistline is greater than 35 inches and you're female, or 40 inches and you're male, that would also be another factor. If the blood sugars are 100 or greater, or you're being treated with medications to lower your blood pressure, blood sugar, triglycerides of 150 or more, or you're treated with medications to lower your triglycerides. And then HDL cholesterol less than 50 for women and less than 40 for men, or on cholesterol lowering medications. If you have 3 of 5 of these, then you have metabolic syndrome. That means you have insulin resistance. Other labs that might be checked: fasting insulin of 8 or higher, a triglyceride divided by HDL that's equal to greater than 2, or a hemoglobin A1C, which is often checked for prediabetes and diabetes, of 5.7 or higher. All of these are indications that you have insulin resistance and you can do something about it. So weight loss options based on BMI. Okay, again, in medicine, we use BMI because it's pretty hard to measure that incorrectly. For anybody with a BMI of 25 and above, lifestyle factors like nutrition, physical activity, and behavioral modification approaches work well for all of these levels. On top of that, 25 and above to 40, 25 to 40 BMI, you could use a device. I will briefly touch on that in a bit. And then a BMI of 27 with comorbidities like high blood pressure, sleep apnea, high cholesterol, osteoarthritis, those individuals with a 27 and above, and anybody with a BMI of 30 and above qualifies for medication treatments for weight. At Rush, we also have endoluminal procedures, which are currently not covered by health insurance, but those are also available. And then metabolic and bariatric surgery. That's another option for long-term weight loss. Remember, for somebody with who's 65 years old and over, a BMI of up to 33 may be okay, right? Again, talk to your physician and see if you have these other markers of insulin resistance. That would give a clear idea whether this is okay or not for you. So let's talk about some lifestyle interventions. A lot of people say, yeah, I get it about the lifestyle stuff, but does it really make a difference in sleep apnea? Well, in Spain, they did a study and they took people with a BMI 25 and above, that's overweight and above, and they basically gave them a weight loss lifestyle program with their CPAP. So they got the CPAP and a lifestyle program for 8 weeks. And then they compared it to people who just had a CPAP. So both groups were treated appropriately for sleep apnea. One got a little bit extra. And they checked the results at 8 weeks and 6 months later. And what they found is that it made a huge difference, okay? So if you can look at the chart, and those of you who cannot see the screen, I'm gonna just kind of read through it. The change in events per hour for apneic episodes at 8 weeks with a CPAP only was 2.5 events per hour. And with the CPAP, when you added in the lifestyle treatment for 8 weeks, it decreased by 21.2. So significantly different. Change in body weight. With the CPAP alone, the weight did decrease 0.66 pounds, but with the lifestyle added in, weight decreased 15.65 pounds, right? So that's pretty awesome, 15 more pounds. Changes in fat mass. So this is actually the fatty tissue that also in the CPAP treated group, they had 3.9 pounds of weight fat mass gain. And with the lifestyle treatment, they lost 6.39 pounds. Change in blood pressure, 2.2 versus decrease of 6.5. And then quality of life also improved with the group that had the CPAP with the lifestyle. This is why at Rush, we're very tightly connected with the Sleep Medicine Center, because also for our patients, even who don't necessarily know they have a sleep issue, if they do and they go and get care with the sleep center, then we are able to have better weight loss results. So this is why this is so important to combo. Now, what about diets? There are so many. Okay, so I just wanted to throw up a bunch of them. There's lots of different diets, and everybody's got their favorite or the one that they totally believe in. I'm kind of agnostic because it's going to depend on the individual and the kind of eating they do at baseline and their other health problems. So I've just thrown up some, and for those of you on the phone, it's like low calorie, low fat, plant-based, vegan, vegetarian. There's the DASH diet, the MIND diet that was designed here at Rush, Mediterranean diet, low carb, keto, fasting protocols like intermittent fasting, whole foods, Whole30, paleo, very low energy diets, for example, protein shakes or meal replacements. Those would be some others. So The good news is there's some similarities among them, okay? So 7 keys to promoting health and restful sleep through diet. So if I just had to like throw out 7 from our experiences. Avoid sleep disruptors, sugars, artificial sweeteners, and alcohol. The less you have of that, the better you're going to sleep. Fasting for 12 hours every night, or if you sleep during the day, whatever, make sure you have 12 hours where your stomach just gets to rest. And so this is, again, like Dr. Zacharias said, don't eat too close to bedtime, right? So that you get the 12 hours, because it'll include the time you're sleeping. So give yourself a fasting for 12 hours. That helps your body reset, get into a rhythm. Stay hydrated earlier in the day. If you're chugging water right before bed, I don't know about you, but I'm going to be up all night, right? So stay hydrated earlier in the day and do more sips later. Protein, protein, protein. All the diets, whatever macros you change or anything, you have to have enough protein. Humans need to eat protein to stay well. And as we get older, it is more important that we get adequate protein, because otherwise we lose muscle. And that is not good. That's aging rapidly. Fiber, basically vegetables, right? You're feeding your gut microbiome and helping your body have all the nutrients that it needs. Choosing real food. There's all sorts of bizarre processed foods that are supposed to look like something or taste like something. Really, the more you can eat real food that you can recognize and you could imagine, going from the farm or whatever to the table, the better that will be. Carbohydrates, there's a lot of ups and downs with carbs. It's definitely going to depend on your waist circumference and your physical activity level. You'll be able to tolerate more if you're more active. You can tolerate less if you're less active. And then again, depending on medications and dietary carbohydrates, the salt and magnesium recommendations might change for any single individual. So again, talk with your doctor and kind of get the scoop for you. All right. The other thing to know is exercise reduces the severity of sleep apnea. So if anybody has severe sleep apnea, this is great, because whether or not you lose weight, exercise is going to help the sleep apnea. And also it works the best if you combine some strength training with some aerobic exercise. So you don't have to, go hog wild, but it is helpful to have a combination of both. The other thing that I want to make sure I point out is if you are practicing intermittent fasting or working on autophagy for longevity, this is trending a lot. It's the recovery and regeneration that is required to realize the benefits. So I'm a huge fan of taking all the necessary components of our lifestyle factors into consideration and applying what's useful. You have to also remember, if you're doing intermittent fasting, you have to also have time when you have recovery and regeneration from that, meaning you got to have good quality sleep. And just remember, all animals sleep. So this is super important. Let's jump into the meds. Some medications that we are prescribing in medicine cause weight gain. There may be better alternatives. So if you notice you're taking a medication that's causing weight gain, you can ask your physician or pharmacist about that specific medication, or you might have them review your meds and help clean it up so that maybe you have some that could be adjusted to help with weight loss. This is a graph. I'm going to zoom in, okay? This is about the weight loss treatments that are available and FDA approved currently. So diet and exercise, naltrexone bupropion, which is Contrave, semaglutide, which is either Ozempic or Wegovy. Ozempic is only for type 2 diabetes, but we hear about it a lot in the media. Liraglutide, which is Saxenda. Tirzepatide is one that we hear a lot about, but it is currently only approved for type 2 diabetes. That's Mounjaro. And then orlistat, phentermine, topiramate, which is Qsymia. And you can see across the x-axis, which is the line across the bottom, that's time in months. And then the lower the dot moves, the more weight loss occurs. So you can kind of see in order on this chart. And those of you on the phone, diet and exercise has alone has the least amount of longer term weight loss. And then the largest amount of weight loss occurs with the medications like semaglutide Wegovy, 2.4 milligrams, or tirzepatide Mounjaro at 15 milligrams. Again, tirzepatide is not FDA approved for weight loss at this time, although it's anticipated that will likely occur soon. So that was a lot. We know that poor sleep raises blood sugars, which can lead to insulin resistance and weight gain, which is associated with sleep apnea. And interestingly, sleep apnea severity correlates with a lower GLP-1 response to glucose. And those medications that I told you about that have the greatest impact, like the Ozempic, Wegovy, Mounjaro, the Saxendas, those medications actually impact the GLP-1 receptors. So that makes sense that it would cause weight loss, right? And so this is just it just kind of loops around. So yes, it makes sense. So if somebody took the injectable medications and they have sleep apnea and they are greater than 65 years old, we have seen weight loss. We've seen that the apneic events improved. There's an improved quality of life related to sleep apnea, improved blood pressure, the cholesterol panel improves, which means the risk of stroke, heart attack, and hospitalizations from heart failure also seems to improve. This manages blood sugars without causing the blood sugars to get too low, which can be a problem for other kinds of diabetes treatments. This improves fatty liver in many studies, and it reduces the number and total cost of medications for many individuals, not everybody. The most important thing to understand about this medication is there are risks, such as potential increased risk of tumor formation. You have to be on it for lifelong, so on. So your doctor will talk with you about it if this was a consideration for you. But the most important thing you can do on your own is absolutely, if this is a medication you are on, you need to be eating enough protein, because you'll get too full on other foods. If you don't eat enough protein, you're going to get sicker. You have to stay hydrated, drink enough water so that your kidneys stay okay. And you have to keep moving. And this is important because otherwise you're going to lose muscle, bone, and this whole picture. You just want to make sure you're doing things to get healthier and have more freedom and fun. So one other study that you may hear of called the SELECT study. This is for semaglutide 2.4 milligrams, which is the Wegovy weekly injectable. They studied 17,605 individuals. Most of them were male. They were 45 years and older with the average age of about 61 and a half. They were diagnosed with overweight or obesity based on BMI. They did not have diabetes, but they did have a prior history of heart attack, stroke, or peripheral artery disease. And what they found is compared to those not taking Wegovy, there was a 20% reduction in cardiac death, non-fatal heart attacks, and strokes. So this is a very powerful study that we really need to dive into, but something to think about. Again, I told you I'd tell you about this device. This is called Gelesis hydrogel or Plenity, and it's basically 3 capsules that you take 20 minutes before lunch and dinner with 16 ounces of water. The capsules absorb all that water, which makes you feel more full, takes up space in your stomach, and then it travels through your gut and in your colon. It reabsorbs the water, and then you poop it out the other side. Now, the wonderful thing about this is it never goes into your bloodstream. So it doesn't interact with medications in the bloodstream or in the liver or in the kidneys, right? So that's wonderful, but it can lead to some sensation of fullness and bloating, some gas. There can be some changes in bowel frequency, some abdominal pain. This is very important to just be aware of. And there is a 6% weight loss at 6 months. Again, most of my patients are not choosing this option, but this is an option as well. Again, for anybody over the age of 22 with a BMI of 25 to 40. There are some cautions if there's gut issues like GERD or gastroesophageal reflux disease, ulcers, Crohn's, any history of GI surgery, like a colon surgery or gut surgery, if there's problems with the motility of the gut or pregnancy. And finally, what about metabolic and bariatric surgery? So patients can expect to lose a significant amount with metabolic and bariatric surgery. And you saw on one of the previous slides, there was one line that dropped down really low for maximal weight loss. And these are the different procedures. So banding, or some people call it the lap band or gastric banding, sleeve gastrectomy, a Roux-en-Y gastric bypass, or a duodenal switch. And you can see the different levels of weight loss with these different procedures. We are not doing banding anymore because we end up having to remove more of the bands than we put place. So banding is really not one of the options, and it actually isn't as effective anyway. So not a huge loss there. This would be something you would have a consultation with a surgeon and learn if this is a good option for you. Sleep apnea after bariatric surgery, unlike medications, which require you stay on them for a lifetime, bariatric surgery improves sleep apnea scores within the 1.5 years. And they kind of studied this with sleeve gastrectomy, which many people are choosing to have right now, that first as their surgery. And when they looked at 219 patients who had sleep apnea prior to the sleeve gastrectomy, and then they went and had the sleeve gastrectomy, they had 96% remission of their obstructive sleep apnea. So that's pretty powerful. Any program at all, you have to think about long-term. Weight loss is a lifelong thing. So when people say to me, I just need that boost, and once I hit my weight, I'm going to be good, we know that's not going to happen. So weight is a lifelong journey. And so whether or not somebody is planning to have surgery, you'll see this purple arrow, that's my team. So we take care of people regardless of whether or not somebody is having surgery. And along the way, they might choose to have the consultation with the surgeon, then see a dietitian and a psychologist, have pre-op visits, go for surgery, and then there's long-term follow-up. And we follow them throughout, whether or not somebody goes for surgery. We're there also to support any of the patients that come to the clinic. So in summary, in older adults, BMI of 23 to 33 is not associated with bad outcomes. Poor sleep can lead to elevated blood sugars, insulin resistance, and weight gain. Obesity is a marker of insulin resistance and is linked with sleep apnea and many other chronic diseases. Lifestyle treatments like diet and exercise work to improve insulin resistance, sleep apnea, and a lot of the other associated symptoms. It's important to eat enough protein, and that is so that you can avoid muscle and bone loss. Some medications cause weight gain, so you want to ask your doctor about alternatives if you are finding that your weight is increasing despite not changing much. And then there's various medical options, such as medications and surgeries that can be used to treat excess weight. And that's all I have. Thank you.
Thank you so much, Dr. Pella. It was wonderful to hear, just how intricately, reciprocal that relationship is between weight and sleep, and, lack of sleep impacting weight, vice versa. Really appreciate all of that information that you shared. It's really helpful. So at this time, we want to open the question and answer portion. And for those of you who have called into the Zoom meeting, if you have any questions for our speakers or a comment to share, please feel free to unmute yourself by pressing *6. We'd love to have you join in this discussion. And for those of you on YouTube, I see a few questions already in the chat, so thank you so much for those. And if you have any other ones, please feel free to type those in. We can start with two of the YouTube questions. Dr. Pella and Dr. Zacharias, feel free to unmute yourselves and turn on your cameras and answer, these however you see fit based on your expertise, or both of you can share in the discussion or answer. The first one is, how is BMI number determined? There was something about weight measurement. Could you explain that a little bit more?
Absolutely. So BMI measurement, you can actually put in, like if you look up online, or there's apps on the phone as well, what you're looking for is your height and your weight. And so it's kilograms per meter squared, which of course we don't use kilograms or meters in this country, but that's the metric that's used. So you can just enter it into a little calculator online, just type in BMI calculator into Google, and there you go. You're going to be able to plug it in and it will tell you what your BMI is. And that, again, no need to freak out based on the labels, but you can use that as sort of a guide.
Thank you for that reminder. And it's so nice to be able to just have Google do, the work for you. One of the other questions that was asked in the YouTube chat is there such a thing as sleep phobia? For example, feeling like you don't want to go to bed?
Yeah, I mean, I would say there is. Sorry. So sometimes sleep or like insomnia can get to the point where, you anticipate that it's going to be a bad night, it's going to be another bad night, and it just kind of becomes this really bad cyclic process, and that can kind of perpetuate itself. So I do think it exists. But there is a lot of help for that. We do see a lot of patients in the sleep medicine clinic who do have kind of like a fear of sleep, and we can definitely assist with that.
Yeah, and who would those like specialists be in the sleep clinic that someone could see? Would that be someone like yourself or a different type of provider?
Yeah, it would be someone like me. It could also be a behavioral sleep medicine specialist, where they kind of take a behavioral approach to finding out what is behind the fear of sleep. Is it some sort of trauma, or is it just things that we do to kind of just perpetuate the problem? Or they can also see a medical doctor who can kind of use a combination of behavioral approaches and medications.
Okay, wonderful. Thank you for that information. There were also two additional questions from the YouTube chat. One is, can sleep apnea ever be cured entirely?
Potentially with enough weight loss is what I've seen. There's also potential ear, nose, and throat surgeries that could potentially also reverse the problem as well.
So it sounds like depending on what might be the underlying cause of the sleep apnea, that it could be, addressed and completely resolved.
That's correct.
Thank you. And so it looks like one of the callers may have unmuted themselves. If you want to ask a question of Dr. Pella or Dr. Zacharias, please feel free to go ahead.
Thank you. I've been hearing a lot about circadian rhythm as it affects our sleep time. And so could we talk about a little bit about that? I think it's connected how important one of the doctors said, keep steady when you go to sleep and when you wake up. but can you talk a little bit about circadian rhythm?
Sure.
Thank you.
So the circadian rhythms, it's kind of like your internal clock. It's in every single cell of your body. So the master clock is in the brain, in the hypothalamus. That master clock kind of sets the pace for every other cell in the body. In terms of sleep, the circadian rhythm it's there in the background. It kind of gives your body some cues as to kind of when it's kind of time to sleep and time to get up. And that kind of manifests itself in getting sleepier as the evening kind of comes on. During those kind of few hours preceding, like your typical bedtime or the typical time that you would sleep, the melatonin starts rising and reaches a peak at a certain point. In the middle of the night, prior to kind of waking up, your core body temperature actually dips down to its lowest point. And after that, it starts steadily rising. And as it steadily rises, that gives your body a cue that it's time to get up. Unfortunately, the circadian rhythms do change as we age. Those rhythms just aren't as strong as they were before. They tend to kind of move forward a little bit. And so how that kind of manifests as symptoms is getting sleepy like really early in the evenings, like 5, 6 p.m., and then waking up really early in the morning.
How can we change that so it would be more normal to be up when it's daylight and it's a little safer for older people and maybe those of us who are visually impaired, legally blind, to do our activities when it's a little bit not so dangerous or challenging? How can we adjust that? I find myself sometimes, oh my goodness, 7 p.m. How can that be? I'm so tired. But I try to push and push because I don't want to wake up at 3 in the morning.
Yeah, there are ways we can treat it. For like what we classically see in older adults, it's considered like an advanced sleep-wake phase disorder. And what we commonly do for that is actually a little bit of bright light in the evening to kind of push the clock forward. Yeah, so even just
interesting.
I mean, now that it's getting kind of darker earlier in the evening, you may have to use like an external light source. But in the summertime, it's kind of great. You get that evening light should be enough to kind of push you a little bit later in that bedtime.
Yes, that's good advice because I've been forgetting to adjust. Someone, a sleep person, mentioned during these long summer days, when you get up early, I love to get up 6:30 or so, then not to stay up so late, put sunglasses on when you walk upstairs, where the bedrooms are or whatever, sunglasses. So I've been trying to do that and keep the, bright lights down, but I am going to shift to the shorter days time. And thank you. I did not connect that, and I will do it. Stay bright light later and stay perkier longer and sleep to a decent time in the morning, hopefully. And I do have sleep apnea, so I use my CPAP machine, which is a little bit problematic, and I'm slender. So it's I don't know why. I think deviated septum that didn't get restructured properly or whatever. Now I'm 82. I don't want to go through that again. So thank you. You've been all very informative. I appreciate it.
You're welcome.
Yes, thank you for that question, and for that reminder too, especially with the change in seasons and it getting, darker, shorter days and everything. We can find ourselves sleepier much earlier in the night, and that disrupts, the whole the whole sleep cycle, and then the next day.
Mm-hmm. Mm-hmm. Yes.
One of our next questions was, Dr. Pella, you were talking a lot about protein, and was just wondering what is the best form of protein to get, as well as what would be the recommendation for the amount or like serving size of protein for older adults?
Love that question. Absolutely. Yeah, so obviously it's going to be better to get protein from a real food. So there's foods like eggs, cottage cheese, chicken, seafood, turkey, lamb, beef, pork, whatever. There's also tofu, quinoa. There's other kinds of legumes, right? Chickpeas, things like that. So there's lots of different options for real food proteins. Some people do protein shakes. I'm less of a fan of that because it's a lot of stuff that's unnecessary that's often thrown in there that may or may not aggravate the body. But that aside, a really good way to assess if you're getting adequate protein is to think about, if you hold up your hand and you chopped off your fingers, the thickness and the size of the palm of the hand is actually about one portion of protein for your body and your musculature. So you might know people have really big, beefy hands. A portion of protein for them will be bigger than somebody who's got dainty little tiny hands, right? Because they have a different amount of muscle on their body. So if you think about that as one serving, you probably need between 3 to 4 of those a day. So if you look and you crack a bunch of eggs and scramble them up or whatever, you want one serving would be enough that it would be about the size of your hand. So for some people, it might be 4 eggs, and another person, it might be like 2 eggs, right? So you can kind of look at your palm, because the palm is a great place. It's got muscle, but it doesn't have any fat tissue. So that's a good way to know, like, how muscular are you? And that's how you definitely want to maintain enough for that. If you are working out, and I know many of my older individual patients who are like working out amazing, demonstrating amazing strength and progress, they will need a little bit more protein. So I would err more on the side of 4 times, 4 times the palm size versus 3.
Wonderful. Thank you for that answer, and a great visual too, that we may not have a scale or something to be able to measure something exactly, but yeah, just having that available is good. There's a next question that came up in the YouTube chat, and that says, my husband gets up after going to bed at 9 or 10 p.m. And then is still tired until noon or even 1 p.m. Is there something that he could do to help change this?
Is he getting enough sleep? I mean, I would kind of look at several different factors. Are you getting enough sleep at night? Is the sleep quality good? Are there other external factors that could be contributing, like sleep apnea, restless legs, like kicking at night, dream enactment? So there could be a lot of factors that could be playing a role in sleepiness during the day.
Gotcha. So it sounds like there's, maybe some more follow-up questions to that, like that they could look into, because it sounds, based on what you were describing of like the amount of sleep that we need based on our age category, like if we're getting, a solid night's sleep, it doesn't sound like we should be continuing to have that daytime like sleepiness or fatigue.
Yeah, and I would say, I mean, there is kind of like a natural dip in the circadian rhythm after lunchtime, but it shouldn't really be much beyond that. So if the fatigue is kind of throughout the day, during kind of activities, then more needs to be kind of evaluated for.
And another question, kind of leading from that, like, let's say we do wake up in the morning and it takes us, some time to really like clear our head, or feel like we're fully awake. Are there any things that we could do to kind of like help give that boost to get going in the day, aside from, what we would normally do, grabbing our large cup of coffee or something like that?
Yeah, I mean, it is normal to have that kind of lag in the morning. There are kind of studies to kind of suggest that it can take up to like 2 hours to kind of really kind of wake up. But things to kind of accelerate that process, bright light is actually probably the most effective. So you're just kind of getting either some natural sunlight, or if it is kind of dark and gloomy outside, especially as winter approaches, maybe just like a little light exposure from a light box should help.
Okay, sounds good. And one question that I had is, I feel like when you're reading about health news, or just even like across healthcare settings, you're hearing a lot about insomnia, and I don't know if that's just like kind of something that's on topic right now, or if you're seeing more reports of this. Dr. Zacharias and Dr. Pella, have you seen maybe an increase in diagnoses of insomnia or symptoms of insomnia in your practices?
I have, especially during the COVID lockdown. Things did kind of accelerate. A lot more people complaining of insomnia. A lot more people kind of just being more in tune with sleep, and I guess having more time, maybe spending just kind of confined to their houses and not getting enough physical activity. So we did see a big spike during COVID. I would say that's kind of leveled off. Things have improved as people have gone back to work.
Yeah, obviously, Dr. Zacharias would see this a lot more than I would, since I'm not really diagnosing insomnia for individuals. I'm really working with them on their lifestyle and weight stuff. But I am hearing a lot more disrupted sleep. And then I would, of course, send them to Dr. Zacharias's office. But a lot of disrupted sleep, often due to, anxiety, depression, feeling social isolation, job change, job insecurity, in a lot of the global unrest. And right now, there's so many people that are hurting and suffering that, when we engage with the news or social media or pretty much anybody, you're hearing about suffering somewhere. And so it interferes with the ability to settle down at night. And sometimes when we get into bed, that's the most quiet time of the day. And it allows the brain sort of free rein to start thinking and having a conversation with you and trying to get your attention. So we're seeing that a lot from that aspect. What diagnosis they end up with, I send them to Dr. Zacharias and she figures it out on how to best take care of that component. But it is good to recognize when sleep has changed and is disturbed. There's so many options available on how to take care of that. And it's way more complex than I ever knew before I went to med school and before I worked with this great team here. So I think it is worthwhile to dive in and, get some answers.
Yeah, thank you for sharing that. And it's great to see, how both of your clinics work closely together, and complement, each other well. So that's wonderful. Our final question as we get towards the end of our time together is in talking about sleep hygiene. You were saying that it's good to reserve the bed for, just sleep, not associating it with other activities. But some of us like to read for a little bit in bed, or having sex. Like, are those things okay to still have as something that an activity that you do in bed?
Yeah, it kind of applies more to people who have kind of trouble sleeping. And it's really to kind of maintain kind of healthy sleep over the lifetime. So it is okay to kind of do those things in bed. I would kind of try to prioritize the bedroom for sleep. So as an example, like if like in the middle of the night, you kind of wake up and you're not able to get back to sleep within like a reasonable amount of time, like 10-15 minutes. You don't want to like keep tossing and turning in bed for hours. So that kind of creates that negative association that the bed is kind of more for being awake, thinking about things, running through your lists, running through your to-dos. Really, it's the bed is for sleep, but some isolated activities like reading, sex, that's fine.
Gotcha. That's very helpful to know. Well, this concludes our time, at least for the presentation portion of our lecture event today. Thank you so much, Dr. Pella and Dr. Zacharias, for being here and the wealth of knowledge that you shared with our audience. I know I learned so much information, and just based on our discussion, it seems like it was, really beneficial to everyone listening today. And just one last thing, can you go over how folks could get in contact with you, either to schedule an appointment or maybe see another provider in the clinic where you work at Rush?
You guys can schedule online via my chart. I'm both in the sleep medicine section and also in general neurology. The number for sleep is 312-942-5440. And the sleep for neurology is 312-942-4500.
And I also have a phone number for the weight loss clinics. We have 7 clinics around the Chicagoland area and also one in Indiana. So you can see either me or any of my other nurse practitioners. We've got 4 across all of the different clinical locations, so whoever's most convenient. And our number is 312-942-4444. And again, if there's any questions or concerns, you can also message through my chart. You can also ask for appointments through my chart. I'm sure there's stuff online too that I don't even know about, different ways to schedule. And always through Rush Generations, I'm sure there's a lot of contact information. So, yep.
Yes, anyone that has questions about the lecture today, we love to hear from you by calling our 800 helpline, and we can get you connected or your questions answered that way. So thank you again, Dr. Pella and Dr. Zacharias. This last portion of our lecture today will be going over the upcoming programs and promotions that are going on in Rush Generations. So take care. We're really excited to share some of our upcoming programs, especially one that is new to Rush entirely, and that is our Fit and Strong program that is an 8-week workshop that utilizes flexibility and strength training, aerobic walking, and health education to improve your balance and your strength. It is a 24-session exercise education class that takes place 3 times a week on Mondays, Wednesdays, and Fridays. And that will start on next Monday, October 23rd, and will run through December 15th. And the timing for that is 1 p.m. to 2:30 p.m. And we will have that in camp or in person on our Rush campus gym. Registration is required, so please give us a call if you're interested in any additional information or to sign up. Next is our Cancer Thriving and Surviving workshop. And this is a free 6-week workshop for those who are both either currently in cancer treatment or in remission. This group is facilitated by 2 trained leaders and meets for 2.5 hours once a week for 6 weeks, and focuses on increasing your ability to manage your health and maintain an active and full life. It's a very highly interactive workshop, and you'll learn techniques for, coping with some of the frustration, fatigue, pain, isolation, some of those symptoms associated with a cancer diagnosis and treatment, as well as in survivorship. We'll also go over exercise for regaining and maintaining flexibility and endurance, and how to make decisions about certain treatment, complementary therapies, just a whole variety of different topics are covered. So we would love to have you sign up for this. Our next workshop is going to be virtual by Zoom starting Tuesday, October 31st. And running through December 12th. So please give us a call if you would like to sign up for that workshop. Next is our Community Health Mentor Program, and we are recruiting volunteers for this. This wonderful opportunity is for you, or maybe even someone you know who has been diagnosed with a chronic health condition or disability. This opportunity offers you to collaborate with a team of healthcare students to create and work towards a personal wellness goal. Community health mentors are meet with their team 3 times, once in January, February, and March of next year. And you'll receive telehealth training as part of this, as well as a gift card stipend for your participation. So if you would like to get more information or to sign up to be a volunteer, our 800 line is the best way to do that. And next, we still are running our Senior Connections Friendly Caller program. And this is, for yourself, or again, somebody that you may know that might be feeling lonely or socially isolated. And we would encourage you to reach out about this program. This connects you with a trained volunteer who will reach out to you on a weekly basis and talk about whatever is on your mind at the time. There's no requirements or like structure to this, just however we can help you feel more engaged and socially connected. So if you would like to get a friendly caller, please call our 800 line and we'll get you connected. And lastly is our Shulman Senior Voices program. And this aims to empower older adults to discuss what matters most to them as they age. We want to hear from you and hear your story about what is most important to you about aging well, even about today's lecture. If there was something in particular that was an important takeaway from you, we would love to have you record a video to share your thoughts. And you can do that either by the website address or by scanning the QR code on this slide. And our next lecture will be in a couple weeks. It'll be 3 weeks from today, and that will be on Caregiving 101. And we have 2 wonderful presenters from Rush who will be talking about caregiving and supportive resources that are available to you at Rush as well as in the community. And this is our 800 line, which is 800-757-0202. Please call us at Rush Generations for any questions that you may have about the information we talked about today, or to register for any of the programs. We would love to get you connected with our membership and provide any type of support that we can. Thank you so much for your time and attendance today. It was wonderful to have you joining us, and we look forward to meeting again in a couple